me moderating an AI session. So is this okay? So we are in a new world now, right? And the future of teaching may look like this.
Hello. I am an AI tutor on this course. I will be presenting the following slides on an online Train the Medical Trainer course. This course has been specially created for your faculty development needs. The course lead is Dr. Naila Siddiqui Kamal. So let's get started.
Okay, so I'm not going to bore you with the rest of my actual presentation, which was made with my teaching assistant. But
hello, I am an AI tutor on this.
They basically wanted to show that it is just possible, it's already happening, that we have artificial intelligence tutors who are delivering certain types of education. Obviously, you have to choose what would be appropriate. And by the way, this is the educational tutor, artificial intelligence tutor can be live as well, live in the sense that you can raise your hand and the tutor will stop and say, is there a question? And then you ask your question or type in your question, and the tutor can give you response as well. So this is something just to show you. Okay, technology-based medical education. This is something, this is how we learned and we taught in the early days. The skeleton, I remember I had half a set of a human skeleton in my room for my anatomy exams, and we learned on those type of things. But do the students need that with the type of resources that they have in this day and age, where they can learn far better? This is how they learn. So I take a class on like I said, applied anatomy, and pelvis is something. So this is not a skeleton, this is a hologram image that has been created in front of them. So by using the Microsoft HoloLens, you can actually have in front of you with the class a holographic image of the pathology you're looking at. For example, if you're a pathologist, Dr. Nazar, you can actually travel to the organ and see the gross anatomy or pathology, or if you want to go into the histology, you can go down that way as well, and it will look as if we are there with the cells. So this is how innovation has happened. I have a Slido here, and I want everyone to kindly interact. I didn't put in Slidos in the beginning because of time. What do you understand by disruptive technologies? I've given it as an open text. I want you guys to, and there's no cheating, so please don't go to ChatGPT and ask, although I cannot monitor from here. What are disruptive technologies? I'll stop for 1 minute or 2 minutes maybe. There are some, in the chat, there's some text. I don't know, I can't access that. Is that something to do with my teaching, or is it logistics?
No, doctor, there are no questions.
Okay, the texts that are used for wars. Okay, so you're thinking disruption, disruptive. Destroy, okay, one market that destroys another, okay. The distractions, okay, that don't reach the desired outcome, okay. Very interesting. Dr. Nazar, what do you think? I'm putting you in the spot. Okay, let me save everyone the zone of discomfort, although unless you're in zone of discomfort, you don't learn. So there are two types of technologies, okay? One is sustainable technologies, and the other is disruptive technologies. Disruptive is not from the word, the meaning here is not from the word of war or destroy or disrupt or cause, destruction or, in that sense. What it means is that a technology that comes and takes away the place of the previous technology and replaces it. Sustainable technology is that is there, but it develops maybe, but the main technology is there. For example, no, it's not just a robot. Okay, so for example,
Emerging things? Is it a new emerging or abruptly emerging things? The technologies that take their place or take the platforms
yes.
from others.
Yes, very good. So the disruptive technology is what will replace what is already. Let me give you an example, very simple example. In my grandparents' time, there was what? The gramophone, right? The gramophone then was replaced by what? The radio, right? Then the radio may be replaced by what? You have the cassette recorder, let's say the cassette recorder. Then the cassettes were replaced, totally gone. You don't see them in the market with the CD-ROM. Then the CD-ROM are also history. And there are what? My kids had them. What are they
iPod.
called? iPods, right? iPods. So the technology that comes and just displaces. So while a sustainable technology is something there, but it develops. For example, your iPhone 1, then iPhone 2, then iPhone 3, now we are iPhone 16 is coming. Yeah, so it is a sustainable technology unless something else comes and totally destroys and replaces it. So it is not in the way of destruction like breaking or war. It is in the way of removing something from its place and replacing it. Whether AI is going to replace radiologists or not, do you know of um, uh, the gorilla test? Have you heard of the study that is the gorilla test? No? Okay. So the gorilla test is that, well, a group of scientists at Harvard, what they did was that they took some radiologists and showed them an X-ray, and the specialists were commenting on it like there is fibrosis and there is this, and they kept on looking for the white spots, because that's what you look at in an X-ray. Is there any shade or a white spot or whatever shadow? Nobody looked at that they had made a dark gorilla outline in a corner of the lung base. So nobody looked at that because their mind was programmed to look. But if you give that to an AI machine, the first thing the AI machine does, because it has been fed by experts, right? Remember, we haven't replaced the clinician. This is what I keep, because I'm an advocate of technology in healthcare, technology in education, because we have to recognize and embrace it. Otherwise, we will be in the dark ages. So, we are not replacing the clinician by a technician. The clinician is still there. These resources that are developed are the clinicians put in that algorithm. What is an algorithm? That means that if you feed into a computer which has been programmed, let's say programmed that if I see blood in the labor ward, in the sense that the patient is bleeding a lot, that the pulse is going down, the pulse is going up, the blood pressure is coming down, the oxygen saturation is coming down. This has been fed in immediately. The robot or the AI machine is going to give you the right answer that this patient is likely having a hypovolemic shock because of her hemorrhage, and there would be a guideline which you have already fed in, that, you know, do ABC, do this, do that. This is how we have designed it, right? So it's no point in saying, oh, AI is at fault or so and so is at fault. It's just like, you know, when the TV came, a lot of religious scholars said having a TV in the house is, you know, not acceptable, which can be the case, you know, if I believe in that it is there, and now my nafs is going to be um, challenged, and I will use it for wasting my time watching, you know, Indian movies or something like that. But at the same time, if you watch the TV for the, you know, Discovery Channel, National Geographic, or learning or religious education, so it's not the medium at fault, it is how we use it. That is the point that I wanted to make. So disruptive technologies have really taken over. So again, you know, this is almost, I was speaking at a conference, this is about 8 years ago. So already, you know, we are far ahead in what was right at the beginning. So I'm going to introduce you some terminologies here and some technologies and how they are being used in medical education. So we talked about artificial intelligence, which is the most common one that we talk about. What is artificial intelligence? It means that you have a machine. It's known as also the machine learning. Okay, so the machine has been programmed in such a way that it learns from experiences just like humans do. So simple form is your Siri. Yes, on iPhone you have Siri. What is that? That is also artificial intelligence based. You know, you can ask the Siri that where is the nearest pharmacy from where I am. Immediately it will look at your you know, the map, and tell you, okay, the nearest I can see is this. Almost like a human like action. You know, there are um, what is it, the Amazon and Google also have got things that can be kept in the house, and you almost talk to them and say, can you put the heating on, can you put the air conditioning on, or can you put the music on, because they are all linked together. Deep learning is a more advanced form of machine learning. Here, what happens is that there are neural networks. In our mind, neural networks are immediately what are the neurons in the brain. Exactly the same thing, you know, they have devised this machine learning just like the brain does, and the networks are aligned in some ways that they will go down and give you the answer appropriate for the, you know, what has been connected together. So that is the basis of the natural language processing that we see, which is, you know, the commonest is the Chat GPT, and we've got several versions of Chat GPT that have, and now almost Chat GPT can give you answers, but it depends on what has been, you know, what resources it is using. Like, for example, if the Chat GPT goes and looks at the what the medical student was, newly qualified doctor was saying, Sarah, I think, that some medical students have actually put in wrong information, but the Chat GPT you would program it that go for only, and you can put in, for example, NICE guidelines, RCOG guidelines, American College of Obstetricians and Gynecologists guidelines. Based on that, it will give you the answer. It will not go and look for general, you know, what is out there on the net. Similarly, computer vision is your typical, you know, your iPhone. Your face recognition. You can go into your iPhone by face recognition. These are the things that have come about. So robotics, again, I gave you an example of the how robotics are being used. You can program them and they can in real life interact just like a human, but how immersive it's going to be, how in depth it's going to be, depends on how much effort has been made in programming it. Okay, how much effort is, what is its scope of work? Like we say to doctors, always work within your scope of work, which is defined within your limits, right? Same thing for the machine. You introduce it in an area where it is within its limits. For example, I'll give you an example like where robots are used, and you can decide whether, well, it is, nothing is as best as human interaction, but can you guarantee the same level, the same quality, the same um, level of standard with every single individual? Because we are not robots, everyone's got a different style, a different way of in engaging with people. You can't train people in that way, otherwise we become regimental. So but robots can be trained, so the in areas where you need to have a same standard of delivery, where it can deliver that as to the best of quality, then why not? That's my take on it. Obviously, every organization has to think about where it's going to introduce, whether it's going to be beneficial, whether it is a better thing for what is existing, or it's a detrimental thing. You don't want, just because it's a brand, it's something that the world is doing, it's posh, and it's the thing that is going on, doesn't mean we adopt it if we have anything better. And then we are coming with expert systems. There are certain things in decision making which are almost making a better information. So is this the next slide? Yeah. So here is something that this was in Orlando, where I had gone to speak on healthcare innovations, and this was just before COVID. You won't believe, it was just in 2019, just before COVID, when we were talking about telehealth. And within 24 hours, how technology was taken on board. Same thing, we used to be arguing that can we use Skype for our patients who are in care homes, and there would be so much of debate. No, there is privacy issue, there is legislation, there is regulation. COVID came within 24 hours. It was in the legislation that we were to use telehealth. So, these are the things that we have witnessed in our lifetime. So here is what it is basically I am using sensors, and the sensors are just close that. The sensor, that this is a real patient's CT scan, which has been now using mixed reality and augmented reality, being produced on this platform. And the surgeon who's going to operate on this very, very crucial brain surgery, because even if you make a slightest mistake, obviously it has high stakes. So the surgeons practice on these things before they go in. I was able to do a similar thing with breech delivery. So I was able to, with my HoloLens, there was a pelvis and unexpected breech. In developing world, it is not so uncommon, because women may not have had antenatal monitoring. And if it is for those who are not gynecologists, breech is when the bottom is coming down first. And if it is the first pregnancy, the recommendation is to do a cesarean section. Why? Because the body comes out, the head, which is the largest part, biparietal diameter, is the last. And we don't know whether this pelvis will be able to deliver that or not. So here, primary breaches, undiagnosed primary breach, it is a cesarean. So people, what is the consequence? Our students don't get, our trainees don't get that experience of delivering a breach. So with this simulation, which is hybrid. What does hybrid means? That it has got tactile sensation as well. Because simulation, people will say, oh, in the real thing you can feel the sense of feeling is not there. If you are doing a surgery on simulation, you don't feel the knife cutting the skin. So if something has been developed with high ergonomics and all that, then it will have that feel as well. So I was able to deliver a breech presentation. And like I said, we have a need to train our clinicians in breech delivery if they come across an unexpected breech and cesarean cannot be done. What is VR? So virtual reality. This allows the users to immerse themselves in 3D world. So I'm not going to teach you the technology of how they do it, but it is actually cameras, and they capture it. But the important thing is that again, you can, for educational purposes, say you have a consultant in one city who does a type of surgery, and you have trainee doctors in another city. One way would be everyone packs their bags and travels there, and then there are 10 different people hovering on the shoulder of the surgeon and not being able to see anything. Or you could have a video that has been video of that operation, but not capturing actually the real momentum of being there. Or you could have a live transmission. Again, these are all media that you're showing to your students. But another way is that you use the HoloLens or the Google Glass, and this allows you to actually immerse in that environment. So this is an educational session teaching junior doctors the interactions within a theater. So, we are doing something which is a humanity based, but we are using technology for it. Holoport. This is something I'm really waiting for. Already happening, that you can, remember those of you who used to watch Star Trek? How many used to watch Star Trek program? Where Captain Kirk used to say that, beam me up, Spock. There was they would be beamed up. So exactly the same, that if you're wearing these HoloLens, so this is a care home, the patient is in the care home, let's say the doctor is in the hospital, the nurse who is looking after will wear the HoloLens, and will have all the data that is on the system, and the doctor will holoport to the patient's bedside. That's what they've done just now. If you know that there are two astronauts that are stuck in space, and a doctor was holoported up to space to see them. So in 3 model, you can imagine, if we use this technology, you can have a doctor in a remote part. Now you will say that the remote part, how do you know that it will have internet and it will have everyone is getting 4G and 5G. I've seen on Instagram, people putting Instagram posts from the most remotest of village, and they might not have education of other sorts, but they know how to use the Instagram. So it's a matter of how we develop that. So where am I now? Okay, now this is my favorite. 2008, when I was doing the master's in medical education at Imperial, I had to pick a project, and the project I chose, because we were working on that, was Second Life. Does anyone know what Second Life is? Someone very hilarious told me when I was delivering this in Pakistan, the faculty, they said, when you get married, the life after that is Second Life. But it's not that. Anyone?
It's like metaphase or something like that.
So it is actually a portal. It's a virtual life. Yeah. It's a portal where you can teleport yourself. How does it look like? So this is game-based learning. So you can buy or you can have, so Imperial was in Second Life. So you have to log in. my login was Dr. Doolittle. Where am I? Here, Dr. Doolittle. And then you can teleport yourself anywhere you want to go. So, for example, you want to go and visit the Stanford. So sitting where in your house, wherever you are, you teleport yourself live, and there will be other people roaming about. If you come to Imperial, you might see me roaming about. How this has been used is, for example, Imperial used it as, let me just go back. Imperial used it as that students could log in and there were wards there. They would say, okay, this patient is there. So I want to see Mrs. Brown. So they would click on this, and then they would go to the bedside, and this is Mrs. Brown, all her details. She's got lung problems. You want to ask her some questions, and then Mrs. Brown will give you those answers. You want to request some investigations, and all the results will come up here, and then you make a differential. So this is game-based learning, because why? Our generation, the generation we are dealing with, they are programmed differently. They understand. Our purpose is they should know the content, they should become capable doctors. How they become is, you can't force that. No, we were taught this way, you also have to learn this way, because they are not the same, of the same making. So that was that. And I just found this um, during the break, that in BMJ, someone has put in this, that there is a study that artificial intelligence rather than human intelligence, someone said that your membership exam, without any prompts, it could do much better than a human candidate. So, there is a chances of having people who do that much better. There was another question that was asked about social media, and I found this link. And if I'm able to go to this link, so this is Oxford University, and they have this guideline here, social media. So every university will have a guideline which tells what to do, what not to do, and it will have consequences. What is social media? You can say what you can say, freedom of speech, academic freedom. You can criticize your teacher, but in a formative way. You cannot be disrespectful. What is online etiquette? What are the consequences of that you can be restricted, you can be thrown out of the university, and it can affect future employment, because that goes on here. There is a criminal, it's known as the CRB or something, CBR, a criminal background report or something like that, which everyone has. So anyone can, before employing me, can ask the police, can you do this CRB, whatever report on that person? And if there has been any legal issues, it will show on that. So an intellectual confidential relationship with university. And then if someone has found how to complain about that social media and the university guidelines, because you see, these are adults, remember, after 18, although I think we are dealing with babies in adult bodies, because some of them have not matured, but by legal rights they are adults, and adults, you cannot hold hand and tell them what is right and wrong. There can be consequences if they don't do the right thing, just as in life. So again, the last Slido. With all this technology, some of the issues we've discussed, what are the challenges that you recognize can happen? It's open to, yes, loss of trust. And as a professional body, you will, if the patient loses trust, that's it. In one's own eyes, if there is a conscience, you fall in your own eyes. I'm an advocate of these technologies. I don't think AI will replace human totally. It may replace certain tasks which may be done better by AI, but then the human needs to train into things that the AI cannot do. AI is Yeah, AI can be smarter, but at one point when the AI is being fed with the information, that is human, configured information. What AI can do is it can make sense of that information in a much better, in a precise, because remember, what type of medicine are we practice? Precision medicine and um, you know, what's the word I'm looking for? Precision medicine, and it is developed bespoke. What I want to say is individually, it is catering to individuals. What is right for me, according to my genetic makeup, according to my family history, according to my past medical record, a certain type of management is much better than someone else. Empathy and sympathy is something that needs to be put in. I don't have I wanted to show you one other slide, which is where I am with a robot, which is known as Pepper robot, the first robot introduced in healthcare. His name is Pepper, and in pediatrics. So he's this big, this high, and he roams about in the wards. He interacts with the children. The children love him. They can ask him questions, and he can actually voice answers. So it is being used for something like a social person, not just replacing the people, but as an adjuvant. So that's what it is being used for. So yes, the problem in the system, like we had, yeah, right at the beginning. So humans will never lose their place. This is something that, if we brainstorm, access and equality. Not all students, like I said, Imperial gives a iPad to every student. Not every university can do that. So that means that they may not have the same type of advantages as some other. Then there is the cost, developing cost, and then delivering cost, financial burden. Then difficulties in incorporating educationists, we faculty training, as it is, we are training faculty to certain principles which we are trying to align together, and then on top of that put in a learning curve which they are not used to. Not everyone, we have consultants who are still doing computer with one finger with a keyboard, and to subject them to this trauma, that is even it's going to be a big challenge. Quality, reliability, then data security, like you said, assessments. You have to have a very robust assessment team who works with the ICT team to make sure that this is foolproof. Then keeping pace, this is a big challenge. The iPhone, I mean, last year you bought 15, now 16 is there. What if we do all this measure and bring in technology, and all of a sudden, okay, it's like the cassette was gone and CD came, said CD went, and then the iPod came. What's going to happen? The wealthier countries can afford to keep up with it because they make money. At the end of the day, it's all about commercialism, if I'm really being honest. But if with this commercialism, who is, for the other stakeholders, learning can be expedited, can be facilitated, then I don't have a problem with that. Personal development also concerns that if we become, all the time I keep saying to my students, don't become a technician, be a clinician. Use technology, but don't become a technician. And what's the difference? You use your knowledge as a doctor, and then you use that technology. While as a technician just uses, they've been programmed, okay, I have to put the patient through this machine, I have to push this button, this X-ray will happen, this MRI will happen. But you're the clinician, you look at the report and you make sense of it because you have the background knowledge. So that should not go while we use all this technology for the betterment of our students. So, my friends, I come to an end of this marathon run. It is a very difficult concept, putting a lot of people in their zone of discomfort. If there are any questions, please, I would like you to come on camera and ask.
Thank you very much, Dr. Naila. Very wonderful presentations, and it's clear us the way for us for about the AIs and the other tools. Actually, I have been experienced some of the attending Emmy conference at 2020s, which is play in the virtual reality format, so that I go to the conference halls, main conference halls, and they present the Ronald Hardin's speech at in that ways. But the main experience from my side about using the online platforms and different platforms is that most of the generation, what's the generation Alpha, are in the mobile sectors rather than in the computer sector. So how we can bring the things friendly to them in more or less an easy way to go for these platforms. For example, the best example is the Moodle that we are working in it in this course. When there is an online version or mobile version of that, most of the students will engage more. So what is your ideas about this shifting to the mobile side rather than to computer side?
As an educationist, my objective is being met, then I don't have a problem, if they want to use that, that's fine. If they can see, if they can interact, if they can benefit maximally with that, that's well and good. But there are certain things, for example, there is the module that I've made on labor and delivery. It's a very interactive module for Imperial students. Although it will work on the mobile version, but the quality and definition will not be as high as on their iPads or laptops. So then automatically, they move towards that.
I see. Thank you very much.
Thank you very much, Dr. Nizar. And Sarah has a question. Please, Sarah, unmute yourself.
Yes. Thank you very much, Professor Naila, for this great presentation. Actually, in the previous days, I was reflecting on medical education and the AI. And actually, I want to share my reflection with all of you. And actually, I have 4 points that I want to emphasize on. The first thing is that in this course, what I was expecting exactly to attain at the end of this course was to be a medical educationalist. But that's not specific that much. But after finishing this course, I'm not just a medical educationalist trainee, I'm actually educationalist for life. And how is that? I'm not just, for example, like in medical education, you learn the tools and the principles, like, for example, curriculum, assessment, feedback, and critical thinking, research, ethical professionalism, decision-making, and all this words that actually are present in all specialties. Like, for example, if you want to learn, for example, philosophy, if you want to learn English, if you want to learn art, if you want to learn architecture, if you want to learn about theology, if you want to learn about geology, if you want to learn about, I don't know, astronomy or anything you want to learn about, you can learn it through using this educational methods, which are curriculum and curriculum assessment, feedback, and all these tools that we learned in this course. And actually, this, if like I want to give you an example of that. That if you actually, any one of you, if you open a website, for example, of Harvard, of Oxford, of Cambridge, of those like prestigious colleges, you will see in their website they are talking about quality improvement, research. They're talking about curriculum. They're talking about feedback and assessment, because these are the tools that can make the doctor a high quality doctor, and also with the high ethics. So and the ethics and high quality tools of learning, they are what making sophisticated societies all over the world. And this is the first thing. So I'm not just a medical educationalist. No, I'm educational and learner for life. And actually, I made this example. And for example, I want to learn to be more articulated in English. So I'm learning this book. Actually, it's called *Sapiens*. It's just my curriculum. Is just one book. This is my curriculum, and the feedback that I'm gonna get from my peers and my professors, and also the assessment. How can I assess myself in this English? And actually, I will assess myself, for example, in going to national or international exams. For example, IELTS. I can do IELTS in a couple of years or something, that I can assess myself with my English. So I'm a learner for life. This is the first thing that I want to say, that with medical education, you're not just medical educator. No, you are educator and learner for life. This is the first thing that I want to emphasize on. And actually, there's a quote that I really like. There's a Bailey and Surgery Love book. That's like a kind of Bible in Iraq about surgery. And there is a quote in the beginning that's saying from William Osler, which is a well-known Canadian physician who is also a medical educationalist. He is saying, to study the phenomena of disease without books is to sail uncharted sea, while to study books without patient is not to go to sea at all. But I do believe that without medical education, you cannot sell. You cannot study, you cannot do anything, because you will keep on wandering aimlessly. You don't know what do you want, what's your objective, what's your vision, what's your outcome, how to assess yourself, what are the tools that can help you during their educational experience. So medical education is the fundamental thing in learning, not just medicine, every kind of science, every kind of art, humanities, architecture, whatever kind of science. This is the first.
Can I just say, Sarah,
yes.
this might be better if you put in the discussion forum, so that
no, I'll just give 2 minutes. I'll just yes, please. Okay. And also second thing is that medical education can make Iraqi doctors not just good, high quality Iraqi doctors, but also global doctors. And reflecting on that, I in the previous years I did elective in Bristol in Britain. Because of thankful to God and Dr. Hilal and Dr. Shakir. And from there, I learned that the thing that we were talking about was not knowledge exactly. We were talking about ethics, research. We were talking about those things. So those things makes not just high quality Iraqi doctors, but also global doctor. And also reflecting on the point that what kind of physician do you want to treat you? I want ethical doctor, knowledgeable doctor, creative doctor through research. I want professional doctor. I want a creative doctor, a deep learner, problem solver, critical thinker. Those kind of doctor, they cannot be replaced by AI at all, because AI has information, maybe like by the ethical somehow, but like this kind of doctor, like with this kind of deep learning, with this kind of complexity, with this kind of insight, AI cannot be replaced in a million.
That's a debatable statement.
Yes, actually, I think
AI
this kind of doctor, this kind of ethical, and ethical is not an easy word, because being ethical, for example, if you are in your prestigious and the highest status with fame and money, and you make a simple mistake, are you ethical enough to admit it?
What is the definition, Sarah? What do you understand by ethics? What is medical ethics?
Ethics, I think ethics is doing the right thing, regardless of self-interest. You don't think of yourself. You think of the right thing.
What is the right thing? Who decides what is the right thing?
I think this is like not harming the
You
patient.
decide maybe the right thing. I might not. For example,
Mhm.
I have a patient. I have a medicine. You have one medicine. You have steroid or cortisone, and you have two patients, right? And you decide you have to save both of their lives. And how do you decide? One doctor says I will give it to patient A. The other doctor says I will give it to patient B. The third doctor says I will give half and half. Who decides what is the right thing to do?
I think there is an ethical committee that will decide what's the right thing exactly, with like multidisciplinary team that decide. There's guidelines, like for example through research or something.
In Iraq, which ethics team do you follow?
Actually, I don't know. I haven't started my job yet because I'm graduated recently, so I really don't know about exactly.
How was ethics taught in your undergraduate course?
I think this is I think this is a committee. I think this is a global thing I'm talking about.
No, but how did they teach you ethics? In
Through
your
lecture,
undergraduate
through
course,
lectures
you went
mostly.
through 5 years, 1, 2, 3, 4, 5. In the 5 years, was ethics taught as a module?
Yes, it was taught like ultimately, like through a systemic based. Yes.
It was taught. So how did
Yes.
they assess ethics then? Did you have an exam?
Yes, but it's like it was like not a specific thing. Like it was yes or not, was not assessed like really right thing. I think there was a problem with the assessment because it's not an easy thing to assess
Okay, so
ethics.
Dr.
Not really.
said that there is a guide.
I think,
Sorry.
can we stick to our topics for now?
Yes. Oh yeah. Thank you very much. Thank you very much.
It is very wide topic of medical ethics, and it make us. But concerning the AI, how we can trust the AI and the medical information they provide? Because I tested many times, I find give unreliable result and unreliable information. Most of the junior students, especially when they're entering, they try to type in the AI and get the answers, but most of them, this answer is not correct for their conditions. So how we can advise our student on the use of that AIs in the.
Okay, so how the good, robust artificial intelligence, machine learning is based on the guidelines or the recommendations of credible bodies. For example, like we say, anything that uses the green top guidelines from Royal College of Obstetricians Gynecologists, NICE guidelines, or the accredited bodies, if they are using AI based on, for example, ChatGPT, everyone can access ChatGPT, right? Even now, if you open ChatGPT and ask a question, it will give you an answer. Now, Google has got its own Copilot. Microsoft has got its own. Google has got Google Glass or Lens, and Microsoft has got a Copilot. Similarly, Apple has got. So what happens is that you have to specifically ask. You have to tell your students that if you're using ChatGPT or AI, when you form that question, you say, what is the differential diagnosis, or what are the common causes of I'm thinking about my specialty. Let's say heavy menstrual bleeding. Yeah, in a 50-year-old, in a 40-year-old woman, based on, you have to say, based on RCOG guidelines or NICE guidelines or accredited guidelines. They have to put that in. Then it will give you the answer like this. Why not? It's the same thing as we have been doing, going and searching the guidelines online. Here you have it in minutes.
Yes, yes. So
like anything else.
as you should all the time is direct the GPT to give the proper cited information rather to make it an opens and just ask
Yes,
open a
that's
question, because he will give you a multiple source and he cannot even cite the answers. But if you give him a direct, precise questions, it will give you a more predictive answer.
Same thing, like for example, if you have a specific problem with my chest, I've got a bad cough or whatever. If I go to a generalist, they might give me some degree. I go to my GP, the GP will give me a little bit of whatever. But if my problem is complicated, I have to go to the specialist. So same thing is that you direct the chat. This is machine. Machine is going to do what we feed in. It has not become autonomous yet. There are places where it is being used as a third generation, where it is from what it's learned, it is now making decisions. That is a bit of a gray area, but we are not exposed to that.
Thank
Yeah.
you, Dr. Naila. So now Dr. Muhammad
Mohammed Nasir.
has a question.
Mm.
Dr. Muhammad, please unmute yourself.
Uh, Thank you, Dr. Naila, for this amazing session. I personally really like the AI topic very much. I want to ask, do you recommend any current AIs trained on guidelines so we can recommend them to students and even use them personally?
For learning AI.
For learning, yes.
I went to Harvard and spent 15,000 pounds, my friend, at the age of 54. So I was the oldest grandmother there with the youngsters learning because that's the way I am. But now these education, AI education basically is getting more common in fact, when we did our curriculum review, I put this in our Imperial Medical College review, that we must teach our students that learn the technologies that are coming, but more important, change, transformation, adapting to change, not being just fixed in one model and thinking that this model is going to last my whole career. Gone are the days. My mother was a gynecologist. She became a gynecologist in 1958, and she retired as a gynecologist in 95. But I have rediscovered myself 4 or 5 times because things have been changing. Yeah. So I can't pinpoint any particular course, but there are many courses being done by credible universities. But I'm going to bring out a course which, similar on this, which will be very relevant to the educationists. I don't believe in all the other things. I want to know what is good or what is relevant for me to teach my students, to help them learn, as well as a clinician to help my patients. So there will be many courses if you look around online. In fact, I will tell you, Harvard and Imperial, these big universities are doing free courses. So go on their website, and they are, if you don't require a certificate, there are free courses there. Okay.
Thank you very much. I'm very interested in this courses. Thank you very much, Dr. Naila.
I need feedback. Nobody gave me feedback last time also. How are you going to
Thank you.
collect my feedback?
Thank you, Dr. Naila. So anyone else having any questions?
One of the other things that people had, although it's off the topic, but it's very important. I would like you to think about 3 things. What is legal, what is moral, and what is ethical? And then find out, ask ChatGPT and ask ChatGPT for credible sources, and then build on that. And then for medical ethics, how will you follow that? I mean, do you teach it? We were taught as it was just, you role model, you look at your consultants, how they interact. Gone are those days because there are many different personalities and behaviors, but ethics has become very, very complicated. If you want, I can do a session on medical ethics at some point, but especially with Islamic ethics and secular ethics, because I did a workshop in Oman as well on that. How do we make those difficult decisions? So this is very important.
Thank you very much. This is really for your valuable time. We had really amazing experience, and I will search on that. Thank you very much.
Thank you very
Thank
much,
you
Dr.
very
Naila,
much, Dr. Naila. And we will go back to Dr. Nizar to close the module. And Dr.
Yes.
Nizar, the mic is yours. Thank you.
Yes. Thank you very much, Dr. Naila, and thank you very much for everybody to participate in this last modules about in capacity buildings concerning the technologies and the advance. Really, this is what is need, and this is very important aspects that every educators or medical educator should have, and it is the time to change. The time to discover yourself in that field, and don't afraid. We are from the Generation X, but discover that field is an easy way. So you can go into this field, and it will be probably help you in deliver much interesting materials to your student during lecture times or clinical training. I think that was very useful session today's, and thank you very much for your attending. I think if we can take Navar, can we take group photos also?